More than 24 people, many vulnerable, some discharged from hospital, were sent to this hotel, including Chris Semkin's nephew, who is autistic and has high needs.
Initially shocked, and the news reports, I was very concerned.
Now, the province says the vast majority of the group has been moved to an apartment building and is getting proper support.
Over the past 72 hours, Alberta Health and AHS arranged for a mobile health unit, which included a nurse practitioner and paramedic, to offer on-site assessments to all clients.
The Alberta government is launching 4 investigations into the agency that put people into the hotel, Contentment Social Services. The government will look at possible elder abuse and neglect and possible misuse of government income supports and more. And says the government,
I've instructed Alberta Health Services and any of my department not to interact with this particular agency.
Alberta's action comes after CBC News first broke the story more than a week ago of Blair Caniff, who had been in hospital waiting for a care home and wound up at a travel lodge instead. The Alberta government is now looking at regulating agencies like Contentment.
Why didn't the government have oversight on this to start with?
So when they're saying, hey, come live with us here or come live with our organization and we will provide services beyond housing, that is relatively new for what has taken place in the province, and that's why we're going to look at regulating that gap.
This health law expert says the province is fixing a problem it created.
And this case really illustrates the challenges with discharging patients and the fact that that's something that government really ought to have been vigilant about.
Chris Semkin says more oversight is clearly necessary.
Hopefully they take care of it now and actually see to it that these people are taken care of properly.
So, Julia, when are we expecting these new regulations to be in place?
So there's no firm timeline as of right now. We do know that cabinet ministers say it may require legislation, and they're working on some draft options. And the province has committed to making the findings of these 4 investigations public. As for Contentment Social Services, I reached out to them today for a reaction and was told no comment. Heather.
Julia, thank you very much.